Welcome to Real Medicine, Real Lives. I'm Dr. Yassir Sonbol, and together we're showing medical expertise in a human way. Hello, everybody, and welcome to Real Medicine, Real Lives. I'm your host, Dr. Yassir Sonbol, and today I want to begin with something that affects almost every family at some point, which is called medication confusion. A patient may leave a doctor's office with a prescription, pick it up at the pharmacy, read the label, search online, hear a warning from a friend, and suddenly feel overwhelmed. What is this medication really for? What side effects matter? What should I not be mixed? Should I ask before I take it? This is where real medicine has to become real life, because healthcare is not just about prescribing treatment, it's about helping people understand the treatment clearly enough to use it safely and confidently. Today, my guest, Ross Fan, founder of Off-Script Consults. She's a board-certified clinical pharmacist with experience across multiple pharmacy settings, personalized health consultations, career coaching, business consulting, and medical writing focused on digital health publications and medical communication. She brings a rare combination of clinical knowledge, communication skills, real-world patient understanding, and today we're going to talk about how patients can move from confusion to clarity when it comes to medications, health information, and everyday care decisions. Ross, thank you so much for coming to the show today. Welcome to Real Medicines and Real Lives.
Yeah, well, thank you for having me.
Great. So as we begin, I want everyone to watching, to think about last time you were handed a prescription, a lab result, a diagnosis, a medical instruction, and thought, I understand some of this, but not all of it. And that moment really matters. Today we're going to talk about how to ask better questions, how to understand medications more, and clearly how to become a more confident partner in your own healthcare. So we're going to start this by looking at, medication clarity from a patient's point of view. For many people, the problem is not they don't care about their health. The problem is that medical information can feel rushed, technical, fragmented, or intimidating. Medications may be necessary, but if patients do not understand why they're taking them, how to take them, and what to watch for, when to ask for help, treatment can become stressful instead of empowering. So we're going to start off this segment with the most common medication misunderstandings, the role of the pharmacist in patient education, and how clear communication can help people feel safer, calmer, and more prepared. So tell us, when patients come to you with medications questions, where do you begin to see, confusion begin?
Um, I believe it often starts with gaps in knowledge or understanding, likely due to a mismatch in communication preferences or methods. So, we may think that we're communicating appropriately, but everyone actually learns information differently, right? They inhale knowledge differently, and then there's a mismatch there. So, for example, I sometimes notice confusion right from the start when I talk with some patients. I would ask them about a medication, and then they might actually ask me, they identify it by color. So they ask
Mm-hmm.
me, what color is it? Or when I ask them, hey, what do you take this medication for? What did your prescriber tell you that this medication is for? And they will tell me that they don't know. They just said that they were told to take it, so they take it. And it's in their pill box by their spouse, so they take it.
Gotcha. That color thing is really interesting because people tell me that, in the clinic all the time. I'm like, are you still taking this pill? And they'll be like, I don't know, what color is it? And I'm like, I actually have no idea what color the pill is. So I couldn't really tell you. So, but yeah, I agree. And so, what should every patient understand before starting a new medication?
So for starting medications, there are some important things that I believe that everyone should understand. Like I mentioned earlier, why is this medication, what is this medication for? Or maybe I think the more appropriate question is, why is it important to take this medication, right? And then, of course, how to take it. For example, is it daily? How often, with or without food? Things to avoid with it. I also think common side effects are also good to let patients know about so they're not completely scared if certain common side effects happen right away, letting them know maybe when they might notice it go away or when to actually seek medical attention if things get worse. If there are any interactions with their current meds, or whether, the interaction is something to be worried about or not, but again, still letting them know what to look out for. And of course, if they're taking any new medications at all, emphasizing how important it is to let their healthcare team know.
I, I'm really glad you brought up side effects and common side effects versus people get this big insert right whenever they get a medication that has so many different side effects. And maybe you can, as a pharmacist, kind of help people understand why every medication has this long list of pharmacists and what's required by pharmaceutical companies, for example, when they put these drugs out, and the list of side effects that get listed with those drugs. Why is there so many, and what's required by them, so they understand the difference between common side effects and what pharmaceutical companies are required to do when they're putting a medication on the market.
Sure. So, for any medication to be approved as a prescription, it needs to be approved by the FDA. And in order to do that, it requires a clinical trial, right? And in the clinical trial, the medication that you're taking is likely being compared with either a placebo, which is almost like a sugar pill, looks almost similar to the medication, but doesn't have anything in it, or it could be something that is comparable to this medication, but definitely not the same thing. But either way, there's a list of side effects that these study participants can experience, and they all need to be documented down. And then, of course, they get documented by the percentage of the patients who experience it, and that's why the list can be pretty long because patients or the study participants can also experience side effects from the placebo as well, right? And then they need to make those comparisons too. Um, and then some of the medications, of course, this some of the more severe things or the rare ones might not be noticed until after the medication gets approved. So that's like post-marketing surveillance, and then those get added in later as well.
And so when people are looking at these lists, um, what do you emphasize to them as far as side effects in the medications?
Sure. So, like I mentioned, I emphasize the more common ones, right? So that means that a higher percentage of patients tend to experience these side effects when they first take it within the first couple weeks, and then I emphasize things that can be worrisome. I try not to go. I list the ones that can be very worrisome that requires medical attention. So, for example, let's do something simple like an antibiotic. I would usually let them know that, hey, with this antibiotic, you might experience, some GI upset, like some stomach upset, some nausea, some vomiting. Maybe taking it with food would help. So I always try to tell them like some next steps to maybe alleviate the side effects. But then, like for another medication, like let's say lamotrigine, for example, I would let them know about the severe side effect of a skin rash. Right, that's pretty severe. They experience a skin rash with this medication, and that should require medical attention right away. So, in the end, it's definitely up to clinical judgment to decide what to provide to the patient, because the last thing we want is to overwhelm them to the point where they don't want to take it at all.
Gotcha. And so why can it become dangerous when people stop, skip, restart, or combine medications without any guidance?
So I think for me, since I'm a pharmacist, I definitely have some examples in mind. So I'm going to provide some different medication examples. For example, one medicine is omeprazole, right? That medication, most people are probably familiar with it. It's a proton pump inhibitor. It's usually used long term, or I shouldn't say long term, but some people do use it long term for reflux. If you stop that cold turkey, for example, your reflux can come back with a vengeance. So that's not good, right? Reflux is already uncomfortable. It coming back a lot worse is unpleasant. Even as another medication like baclofen, most people see it as a muscle relaxer. They think they should only take it every once in a while when they need it. But if that medication has been taking for a long time and stopping that cold turkey, your spasms can actually also come back with a vengeance as well. So these type of medications, you actually need to slowly taper it over time. to make sure that the side effects don't come back. Like I said, with a vengeance.
Gotcha. No, I completely agree. So, so what does medication confidence look like for a patient in everyday life?
So confidence with for everyday life, how it looks like to me is I think them making sure that they notice that they can take control of their life instead of letting the medical condition take control of them. So, for example, they don't let it. They still feel a sense of achievement. Yes, they do have to take this medication every day, but they don't let it become a reason that prevents them from doing the things that they love. So I believe that that is one way I've noticed that confidence. I've seen that in real life. Of course, they also are proud of it, proud of themselves too. They will show off to you. For example, I have like a patient come up to me and they would say something like, "Hey Ross, I used your diet handout. I was able to lose weight. That was definitely a goal of mine. My doctors noticed that my lab values are at goal. I wanted to decrease the medications I'm taking since it looks like my diabetes are getting better controlled with diet, exercise. My doctors told me they're actually considering it, right? So they show off to me, which feels great."
Gotcha. All right, so what this reminds us of is that medication safety does not begin only with prescription, it begins with understanding. And when patients know what they're taking and why they're taking it and what questions to ask, they're no longer passive participants in their care. So we're going to take a little short break and we're going to come back. We're going to talk about the pharmacist's role as a patient advocate and why the pharmacy counter can be one of the most important access points in healthcare. So stay tuned, everybody. We'll be back with Ross Fan to talk more about this. Stick with us. We'll be right back with more real stories, real breakthroughs, and real lives transformed.